Perhaps, I don't know if you're comfortable removing this. Okay, Bismillahirrahmanirrahim. Assalamu alaikum and welcome to the discussion forum at Habib University. We have our first year students in front of us in the auditorium, and I believe there is our community, HU community, and other colleagues who have joined us online. So welcome. And thank you very much for your patience. We are running a little late, and hence, thank you very much. We have guests in front of us. I'll begin with Dr. Rosina Karmaliani. She is the Dean, School of Nursing and Midwifery at Aga Khan University. She is also Professor, Faculty of Health Sciences there. So welcome, Dr. Rosina. We tried showing you the campus. How did you find it?
Beautiful. I would like to come back as a student.
All right. Thank you very much. We don't have health management courses at the moment, but maybe inshallah in the future. But thank you very much for coming. Next to Dr. Rosina is Dr. Chris Taylor. He's Vice President and also Dean of Faculty at Habib University. Thank you, Dr. Chris, for your time.
Thank you. And again, I'm the reason you guys are waiting so long. My phone wasn't working, and so I couldn't order the car to come and pick me up. And Dr. Rosina very kindly sent her car to pick me up. So I guess deans look after each other. So thank you very much. It's good to be here.
Thank you very much. So as you can see, the topic of today's discussion is moving beyond crisis to a new normal. And this is a subject which is close to our heart, a great concern for students and your parents and the larger community of Karachi, of Pakistan, and beyond. I remember the online session with Dr. Rosina earlier when she spoke with our community, the Habib University community, a couple of months back. She mentioned about COVID-19 cases that emerged in February in Karachi, and I believe in Islamabad. And not only the Aga Khan University Hospital, but other government, private hospitals have done a lot in terms of saving people and treating patients. And she shared the statistics with us. So I would like to ask you, Dr. Rosina, that since then, the graph of number of COVID-19 patients rose exponentially, especially in the months of July, August, and then we saw a downtrend, especially in early September, and there is hope, and we hope that the numbers go further down. But my question is that, is this the case? Are the numbers going down? And what's happening in terms of COVID cases in Pakistan and maybe in other countries?
So, Assalamu alaikum, good afternoon. First of all, thank you so much for having me here. It's always a pleasure to be seeing the students, and because I get a lot of energy when I see the youth around and I see the campus like this, which is a beautiful campus. It seems like oasis in Karachi. So this is lovely. So in terms of COVID and the cases, so epidemiologist, I'm not an epidemiologist, but I work with epidemiologists very, very closely. And we were expecting a surge right after Eid, and that didn't come. Then our epidemiologist said a potential possible surge after Muharram, and that didn't come. So I think something among us, within us, in Pakistan, which has kept the trend not only downward, first it was a plateau, then it was a downward trend. And the cases were unbelievably, but fortunately, very low. And therefore, Sindh government and federal government, public-private sectors, everyone got together, Higher Education Commission, and decided to open up schools and universities gradually with SOPs and then see how we go. Why that happened? It is still a mystery because when I see here, it seems SOPs are outstanding. When I'm at AKU, SOPs are outstanding. But if I'm like this, in many communities outside in Karachi, people look at me and feel that COVID positive patient has come. So they get scared looking at me versus I get scared looking at them that they are not following. So with that kind of trend, how are we having the numbers low? There can be many assumptions. Some people keep saying that it's because we are not doing testing. But that's not the only case because if you don't do testing, certainly you will not identify or screen. But when we were looking at the number of people who were tested, so for example, at Khan University Hospital, if 1,500 people are tested, positivity rate also came down. So the positivity rate, which was once about 60%. So suppose if we were testing 100, 60 were coming positive. Those who were coming with the clinical symptoms at AKU, that went down to 6%. So from 60 to 6%, positivity rate down was clearly showing a downward trend. It wasn't like you were testing 50,000 or 1,500. It was the positivity rate. Also then the death rate, which was there, you don't see that. And death is very difficult to hide. So because it has a registry, and so that registry or at least Maulana and funeral procedures, and we get to know that. So that gets reported. So it is certainly down. Now it's there are two other assumptions. One is that we are more asymptomatic. And we are more asymptomatic because perhaps our BCG vaccine, our immune system, because we are already so exposed, or malaria has been there for ages in Karachi, and the treatment for malaria, very cheap Conin tablet, maybe that. So there are multiple studies now going on, identifying if this is the case. Whatever is the case, to protect the university community and the school community, the most simplest thing is what you are already doing. The three major things you are doing: mask, physical distance, hand wash. The three other things I'm hoping that university students are also doing and not stressing yourself a lot is exercise, proper sleep, and proper nutrition. So if we do this public health, normal health principles, we are good because even if among us, if 50%, let's say, are asymptomatic, but actually positive, you can transfer, you are not showing any clinical symptoms, but you can transfer to others who have low immunity. So if the other person is wearing the mask, is doing the physical distance, has a good nutrition and sleep, will not get it from you. So the issue is us, compliance, and not feeling that now we are good and we can leave all these procedures. So I think that's very important. Now, what will come next and what is happening? You all heard Sindh government announcing schools opening up. So this is a scenario that if several schools were closed because of non-compliance in the audit, not because of the COVID patient necessarily, but if you also see the numbers, today's morning graph is showing upward trend again. And COVID is something that if it's 2 cases today, 20 tomorrow, 200 next day, 2,000 the day after, and 20,000 the day after. This is how rapidly it multiplies. and in the tracing. So I would say as a university or schools, we have to think how Japan is going. So Japan is saying that we have to coexist with COVID now because it is going to last for a year or two. So we, in the new normal, the term you used, in the new normal, if we think that we have to coexist with this, then we have to learn how to live with it. So how to learn with it is, I think you have already adapted. Just continue following the good practice, what you are doing.
Thank you. Just a follow-up question. We all are aware in the last couple of days, we've seen it in the news that a few educational institutions have shut down because of a few cases. Tell us about the readiness of the educational institutions in Pakistan, and if you could touch upon AKU.
So I was very impressed with the material Sindh government released. So I saw the school material, which was sent to the faculty members, the school teachers, school management. Excellent, simple language, pictorial material to the parents, to the kids, and also to the school management. Now, there are schools which are ready because they have the resources and they actually believe that they need to do this. There are schools which feel that this is political, this is government, this has other interior motive, and it doesn't exist. Because they feel if it was existing, you see so many community people outside who are not following, so how come we are not in like US thousands? So people feel that it is unreal. It is not unreal. But the smart lockdown certainly worked very well. Also, other than smart lockdown reduced the pressure on the economic market, especially the labor force. They were not that frustrated, and smart lockdown took care of the tracing and the transfer into transmission fast. So that certainly credit goes to federal government. Higher Education Commission sent excellent guidelines to have university prepared. So you are prepared, we are prepared. In terms of the public universities, it's not the guidelines or it's not the support which the federal or the Sindh government is giving. It's the attitude and the approach and the behavior. So I think unless we come to that grip in terms of the behavior change, and behavior change is not that easy. So institution will have to put in some incentives and some consequences. So students who are not following should be given some consequences of not following this. I think social accountability we all understand. And this is the time to show our social accountability and the ethical framework. So I think AKU, when you are asking how ready we are, so we started from 15th, medical college, so we are starting in batches like the government has suggested. So final year students have come in, so we can graduate on time. When I'm saying on time, the time possible delay. So our convocation, for example, usually in December. Now the convocation, we are expecting the graduation, not necessarily the convocation, in March. So we are 2 month delay. With that 2 month delay is especially because medicine and nursing requires skills. And we don't want doctors and nurses to be in the workforce if they are not safe and not safe for the people, not from the COVID perspective, but from their skills perspective. So we have brought nurses and doctors of the final year back. They are going to the clinical areas. So we have created hospital within a hospital. So our COVID patients are in one building, and that building is negatively pressured. So rest of the building is safe. So doctors and nurses with the PPE, now the students are placed back in the clinical areas. So they learn, and then with safety, then they are able to. Hostel is on 30-40% capacity. Classrooms are on 30-40% capacity. So we are doing the hybrid model. We are not going for theory classes all face-to-face. We are saying those who are outsiders in the hostel can come or use the better connectivity from their rooms for the theory classes. Those who are in Karachi and have a better connectivity continue from their home. So we are continuing the VLE environment, blended learning, and then those who have to necessarily do the CIME and the clinical should only come. So in that, we are restricting the crowd even further.
It's interesting. Thank you, Dr. Rosina. Dr. Chris, there are quite a few, I'm sure, parents of our first-year students who are online and listening to us, and students who are present here and those who are online. Um, uh, I'm sure they would want to hear from you about campus readiness as far as safety is concerned at Habib University. Would you like to share?
Sure, and I'd like to just add a couple of points more to the excellent presentation that Dr. Rosina gave. I think we're now a good 6 months into this pandemic. I was watching a Harvard epidemiologist last night talk about the future. What does the future hold? And he was saying that, okay, let's just suppose for a moment that we're going to have a vaccine by January 1st. He said it's probably going to be 2 years before we have enough people vaccinated. All the main vaccines that are showing promise right now are indicating that they need 2 doses spread a month apart. If you figure that out, multiplied by the number of people in the world, you have to get 60 to 70% of the world vaccinated before we're safe from this thing. And he said, you just have to do the math, and it's 2 years. So I think what Dr. Rosina and Shamez were saying, we have to learn to live with this thing. And the good news is that after 6 months, we know a lot about how COVID works. And we know that this virus depends upon people being closely packed together in poorly ventilated internal spaces, right? Out of 7,000 cases, they were tracking in China, only 1 could be attributed to an outside event, right? So this thing is definitely aerosolized. It can spread by touch, but it most effectively spreads by micronized particles that are floating in the air. It apparently can attach to dust, so it can stay floating in the air for literally a very long time. But in an environment where people are appropriately distanced, where people are wearing masks, and where there's good ventilation, and places like AKU and Habib have been very careful to make sure that our filters, we're using HEPA filters, the highest grade HEPA filters, which are the same ones that they're using in airlines, that really remove 99.9% of everything in the air. So we know that, and most importantly, we know that it depends on how a community responds to the virus. And the unfortunate example is my own country, right? Where literally 1 year ago, I think it was WHO did a study and said, what country in the world is most prepared for a pandemic, right? And it was the United States. What country a year later, right, is showing the worst record in terms of number of cases, in terms of number of deaths? It's the United States. 20% of the world's deaths are in the United States right now. So this virus, it's very clear that if a community responds appropriately, as people are here, right? They wear masks, they keep socially distanced, they wash their hands, they check their temperature on their way in, and so forth. We can live, and we're showing we can live with this thing. We can live, and we can not get sick if we're careful. I'm sure, like AKU, we have done extensive surveys of every space on campus, both internally and outside, to determine the exact distance and what is the maximum number of people we can have in a room. It's usually between 40 and 50% of what we normally would have in a room. And we're being very rigid about sticking to that rule. We're not trying to squeeze a few extra chairs in or anything like that. We, just like AKU, and I think we're probably the only 2 universities in the country I know of right now that are doing this, which is the blended high flex response, right? So the 2 other alternatives are the LUMS model. So LUMS went completely online, and IBA went completely in person. Okay, we know the IBA didn't end well. Within 2 days, they had to shut down because cases were starting to appear immediately, right? And so I think that the reality is that for the foreseeable future, the universities that can deliver and that's what our emphasis right now is on, delivering exactly the same experience, whether you're in the classroom in person or whether you're online. That's where our target is. And it's a very hard thing to do. Teaching, simultaneously online and in person is a hard thing to get used to. And we made a big investment over the summer, as you probably know, in a brand new learning management system called Canvas, which is really the most advanced in the world. We were the first institution in Pakistan to adopt it, and we also use Panopto and Zoom for asynchronous video recording and management, and Zoom for synchronous classes, which are automatically recorded, downloaded to the web very quickly, so that, because we know that our students are living in situations where power, is not 100% reliable. So you might tune into a class from your home, but then suddenly load shedding happens and you're disconnected. Not to worry, it's all being recorded. You'll be able to get back on as soon as your power comes back. You will have missed nothing, right? So, and I think that's the response that's the kind of response that's going to allow us to get through this. If this really does last another 2 years, the students at places like AQ and Habib, I think they're going to be okay, because our goal is to ensure that your education stays on track, and that you're not delayed and so forth. And so I think that inshallah, it won't last for 2 years, but I think we need to be prepared for the possibility, right? If the last pandemic of this magnitude lasted 3 years, so that would be right on target. That was the Spanish flu back in 1918 to 1921. And it comes in a series of waves, as we're seeing right now. So countries that thought they were out of this, back in May, like Spain and France and other countries, are seeing an uptick. So we can't get, obviously, we don't know all the dynamics of what happened, unfolded in Pakistan. We can't explain exactly why right next door in India, it's a very different scenario, right, than it is in Pakistan. I've seen very interesting speculations about it, which have to do with the way that Pakistan is, the densities in Pakistan, and Karachi was used as the example, comparing Karachi to Mumbai or Delhi, which are cities of the same size, roughly. Karachi is a much more spread out city. When I first arrived in Karachi, and I'd lived in Cairo for a number of years, and I was telling my wife, I think Karachi is about the size of Cairo. It turns out Karachi is twice the size of Cairo. But I didn't realize that because it's not high. It's spread out very far and wide, and it takes forever to get from one end of Karachi to the other end of Karachi. Not because of the traffic, just because it's big. So I think that's the reality that we're and we can't get too overconfident, right? This virus laughs at those who get overconfident, right? It's very vicious, right? And we've been very, very fortunate. I think, Pakistan locked down very quickly back in March, and really around the 1st of March, things started to close. All universities were closed since 1st of March, and have stayed closed really until last week. So I think the early lockdown was hugely important in what happened. But again, the weather will turn cooler here in another month or so. And we know that just because of the way the aerosols work, it lingers longer in the air, right? The cooler the temperature is, the more deadly this thing is going to become. It's obviously not totally, heat in the United States in the summer, it took off, right? So heat is not 100%, but our suspicion is that because of the way the aerosolization works, that the hotter it is and the drier it is, the aerosols, it's harder for the virus to transmit that way. So without getting overconfident, and the other thing that we have to, what's so frustrating about this virus is that somewhere between 40 and 65% of the people who get it are asymptomatic. They don't know they have it, right? And I read a report recently about testing at AKU, in fact, and they were saying that they're testing people who for the antibodies, and they're finding very high rates of people. And people say, "I wasn't sick. What are you talking about? I can't have the antibody. I never got sick." And so that's what makes it really tricky, is that we don't know quite the dynamics of why that is. We also, and this is really targeted, and this comment is really targeted at young people. A lot of young people think, oh, well, it doesn't hurt young people, right, the way it does. It can be deadly, we know, for older people. But the reality is that we're now discovering that even people who were asymptomatic as young people, right, that they may be suffering permanent heart damage because of the way this thing unfolds, right? I have a colleague here whose parents he's from Italy. His parents were traveling in India at the outbreak. They were traveling with somebody from the Milan area who had COVID. So they got COVID in India, but not from an Indian. They got it from a fellow Italian who was traveling with them. And they were hospitalized. They tested positive for COVID and showed absolutely they were asymptomatic, no problem. Recently, my colleague's father had to have a heart pacemaker implanted, right? So it did damage he never felt sick for a day, never had a temperature, never had any signs, but it did damage to his heart muscle. And the heart is one part of the body that doesn't regenerate, right? So any damage that's done, it's for good. So we have to, this has to be a collaborative effort in each community, right? And the results our fate is in our hands here, right? How we respond to it, how we have to take it seriously, because even young people who are asymptomatic, we don't know what damage is being done that they will feel 10, 15, 20 years down the road that will be permanent damage, right, from this thing. So everybody needs to take it very seriously until we reach the point where we either have a vaccine or we have, the epidemiologist was saying the other night, he said, look, if we deny the virus the ability to spread, it will not spread very much. And if we really deny it the ability to spread, it will go extinct, right? And so, and we know that simple things like a face mask. There was an interesting case of a hair salon, and this is in the United States, where both of the beauticians who were doing people's hair didn't know it, but they were both COVID positive. And they had done the hair of 139 people before they realized that they were COVID positive. But because they were wearing masks, not one of their customers caught the virus. So this stuff works. It really does work. So I don't know if that gets to your question, but yeah.
Thank you, Dr. Chris. I have one final question for both the panelists, and then I'll open the floor for questions from you all and the online community. So Dr. Chris, lessons learned for educational institutions, particularly in Pakistan.
Okay, that's a long question. I'm not going to give you a long answer, but what I can tell you is that the face of education has changed forever. It will never be the same again, right? And I think, my sense of it is that all of the things that we're doing have actually, all the online stuff that we were, it's been available to us for the last, 15 or 20 years even. But we didn't, that we thought we were just in the business of face-to-face classroom. What did online really have to give us? The pandemic forced us into the world of online. It forced us into the future, I think. And as we look at online tools, we're discovering, oh my gosh, you can actually deliver a better education in a blended model than you can, without the online. So I think that what it's taught us is this, regardless of the pandemic, this is what the future looks like. And hopefully it's in a time when we're not wearing masks and we're not worrying about a virus. This will pass. But what will not pass I'm convinced now, is the face of education has been forever changed by this event. And education will go stronger and better because of this change. And so there's lots of different, things that you'll begin seeing, I think. Asynchronous learning, right? If you think about it for a minute, it's not very efficient to have a professor get up and give the same lecture year after year in front of a different, why not record the lecture and put it asynchronously? And even better, because a 50-minute lecture, right? We know a lot about how humans learn, right? And after about 20 minutes of a person talking, that's why TED is always 20 minutes, right? Because they know that after 20 minutes, the interest, the ability to focus goes down. So if we can get professors thinking in terms of, what about instead of a 50-minute lecture, what about 10 5-minute lectures or 5 10-minute lectures, right? And recorded synchronously so people can, access them whenever they want to. And then we can use the time in class much more efficiently and effectively, right? So that's just one small example of I think how things are going to change.
Thank you very much. So a blessing in disguise when it comes to quality teaching, technology, distance learning, safety. So thank you for that, Dr. Chris. Dr. Rosina, for researchers, teachers, students, whether it is AKU or Habib University or other institutions, how does the new normal look like for the education community?
So I think some of the things have been already mentioned in terms of the technology. So I'm bringing it to the student side now and the researcher side. So I think we have to think of our approach to adult learning and education for what? So many a time students, and especially you are here one students, of course our eye is always on GPA percentages because these are the deliverables which takes you to the next level, to the next university. You want to go to the Ivy League, a different level of GPA. So it's all quantitative game so far. And teachers have been doing hand holding of the students. Now with this approach, it is still deliverables and the quantitative and all of that, but then the process is different because now in the process, teacher is not necessarily hand holding in person in the same way. It is a lot on an individual in the virtual learning environment to make yourself ready for the learning from the content which is coming asynchronous or synchronous mechanism. If you don't do this, then it's your loss. So it's more adult learning taking the responsibility of doing it. The other area is the entire scope of assessment. We have to think, educationalists and researchers also, when we work with the community, what we are publishing. So approach of assessment, we have to invest in the digital and software, that how and what level and kind of assessment would be appropriate in the VLE environment, which were maybe we were not using as in person. So I think Higher Education Commission and universities have started thinking about making a task groups that if assessment is part of the heavy learning for the student, how assessment should be modified. A third area which I want to highlight, and more so since you are just starting your journey, is the ethics of education. So students taking the honors on yourself that it is for learning, then whether the person is sitting next or I'm doing the assessment from home or my friend has the same question as I have and literally everything is available for you to exchange and share and do your response and get the GPA, you can perhaps get away with it for half a semester or a semester. But if you think of an ethics of teaching learning and you put the honors on yourself that did I get what I paid for? When I was in University of Minnesota, in US and taking health policy management. One of the course was healthcare finance. Day one, my teacher came in class and said, do you know a stakeholder which like to pay more and get less? And everybody was thinking that whenever we go to shopping place, we negotiate, we want to pay less, we want to get more. You go to a restaurant, you eat and say appetizer free or dessert free, you pay less, you want more. So there was a silence in the room because it was the healthcare finance. People started thinking, so the patient is paying more and asking for less or what? And he said, student body. Because they pay the full fees and they are happy with the vacations, learning less, having less things. We don't demand, we don't put the pressure on ourselves and on the institution and the organization that this is what we should be getting in return from yourself also and from the institutions as well. That is going to change now, which I feel that the students will be more taking the accountability and responsibility for their own learning, but also pushing the institutions to be able to give them what they need. And therefore, your ethical parameter, your learning parameter, your assessment is going to look very different as you move on. For the institution and for the researchers, I'm thinking access and equity and fairness principles will also come in. So like 50% of my students are in Gilgit, Baltistan, Chitral, interior Sindh, interior Punjab. And if they are not in person, it is very difficult to even do the asynchronous with them. So we had to think out of the box. So what we tried, and we are still in the pilot phase, it worked well for the last semester. Well, in a sense, well is also a relative term now. So well from what? But it is better than not giving this access and equity is we did university school partnership because schools are everywhere. In GBC, you see AKES school, government schools in interior Sindh and Punjab. School structures are there. It's about the faculty and the quality level faculty. So we started using those schools and upgrading those schools' computer labs with the digital mechanism and janitor backup facility. So at least collectively, they can go near their home and get the access to the asynchronous and synchronous facility. So we don't have to forget those who do not have what the people have. So the gap between have and have not needs to be addressed much more by the researcher, by individual students, and by the organizations. So I think the entire paradigm of ethics and ethics of education needs to be introduced.
Thank you very much for your insights, both panelists. Students, our online community, if there is any question, please feel free to ask. Okay. Yes, any questions? You have both the deans sitting here who are responsible for academics. So they deal with students, teaching, learning, something which is close to you, something that what you do every day. Anything you would like to ask? Yes, please.
Hello, Sankum. So you've spoken a lot about the academic side of it. I'm wondering how you think, the social aspect and the camaraderie that you build from just hanging out on campus or the events that you attend, etc. What do you foresee about, this side of university learning?
Dr. Chris?
I think it's an excellent question. And again, my sense is that it's possible, right, to do that. But it's better, as long as people are thinking in terms of where they are, physically where they are. For example, we have lots of courtyards here, so maybe better to sit outside and just chat with people and things like that. Remember to keep the distance. I think that we're already getting to the point where, I mean, a gathering like this would have been unthinkable 4 months ago. I mean, I just couldn't have even imagined doing it. And yet now, because we know how this thing works, we understand. Remember, originally they're telling us, don't wear masks, don't wear masks. And then they were, oh, nope, wear masks. So we were, we were unsure. But now, 6 months into it, I think we know a lot more about it. And I think that the thing we have to overcome right now is, I think that a lot of people are still kind of paralyzed by fear, right? And they're just so worried that because maybe they don't fully grasp the dynamics of how it works. I don't know, but I think that the good news is that as long as we're careful and everybody is paying attention to to the safety guidelines, that it's perfectly possible to sit next to each other, have a conversation the way we would have before. Yes, we have to be a little bit on our guard. We have to be wearing a mask and so forth for right now. And it does create for this generation of college students, a difficult initial experience. But my sense is that people are figuring a way. They're figuring the way of how to deal with this thing. So it doesn't if we're all locked in our homes for 2 more years, right? That's going to be really bad, and it's not necessary. We know that now. It's not necessary, and as long as people just pay attention to the circumstances that they're in and so forth, and use a lot of common sense, and the 3 things that Dr. Rosina talked about, frequently wash their hands. Actually, that's going to help us in a lot of other germs that we're going to, if we really are washing our hands on a regular basis, wearing masks, and keeping social distance, it's not just COVID that we're going to stop. We're going to stop a whole lot of other illnesses as well, and which is a good positive thing. So I think that it's a new challenge, but it's not an insurmountable challenge. And I think that we're seeing just by this gathering today that, I mean, I didn't worry about coming here at all today, except for when my phone didn't work and I couldn't get a car and so forth. But I mean, I normally drive around Karachi in Ubers, right? But I'm very careful, right? I don't use cars that are air conditioned, Ubers that are air conditioned, because people have been sitting in those cars all day and the air is circulating around and around. That's probably the most dangerous part of the day, is coming to the university and going home from the university. So I'm very careful to select the Uber Go, because the windows are rolled down and I don't, that there's lots of air flowing around, fresh air that's flowing around. Very hard for the virus to transmit that way. So we've learned a strategy. Before I was like, oh my gosh, how am I going to get anywhere in Karachi because I use Uber, right? And then when I began to learn a little bit more about how the dynamics of the disease work, I realized, okay, well, a car with windows open, in 90-degree weather, driving at 50 kilometers an hour, there's no way that virus is gonna, especially if I'm wearing a mask, I'm not gonna suck this thing up. And so, we also know that it has to do with how long you're in contact with the virus. It's not just 1 second. It takes about 15 minutes of being in an atmosphere where there's a lot of the particles floating around. So keeping ourselves out of situations where we're in an area where there could be particles that have been building up, right? That's, I think, the way to get around it.
So if I may add, so social life is very important, especially at this age. And it's not going to be same, but we have to find ways and means to be engaged in a way that mental well-being is restored. And while we talk a lot about our physical health and physical hygiene and hand washing, we have to think about our mental hygiene as well. And mental hygiene is extremely important. And the 3 things in mental hygiene, first of all, acknowledging that it is different and it is going to be different. So accepting the fact that our social life can be restored, but in a different way. So like more open spaces, but because our culture is a lot around the food and our gatherings are a lot around the food, and while eating, you have to take your mask off. And therefore, sitting in open spaces with distances and then minimizing eating together. So I gave you the fact at AKU, you are not connected to the hospital. We are connected to the hospital and we work with patients also, right? So initial 3 months, the analysis suggested the employees who were contracted with COVID, only 10% got it from the patients. 90% got it from the peer. Because while they were working with the patient, they were fully equipped, they were wearing PPE, but then during the break times, during the lunch times, or when they were done with their duties, when they were chit-chatting with the socialization, then they would take off mask and they would say, harsh, we are relaxed now, we are not with the patient. So it's that harsh moment which got 90% into the trouble among the employees of AKUH. So I would say that we are not yet at the stage until the vaccine comes, and I don't want to repeat that. You all heard that. Until that time, your harsh moment has to be different. So the mental hygiene is that you accept that and you create the social spaces. Institution has a responsibility to teach everybody how digitally remain safe. Because it's a lot social contact is through digital equipments and cyberbullying was already pre-COVID high. And therefore, that's institution responsibility to teach students how to be safe and how to be responsible at the same time. Also, second stage is that you should have some mechanisms of ventilating. And when Shamiz, you asked me what AKU has done, so other than this physical environment, I'm sure you would have also, and conferences or meetings like this are also helpful, but having a panel of counselors, psychologists on board for students. So whenever you feel any fear, anxiety, stigma, these are very common, we do that. In spite of doing all the safety measures, there will be people who will be COVID positive. So we don't have to play the blaming game. That, oh, dekha, isne mask nahi pehna tha. See, he is the one or she is the one who's spreading. So no blaming game, because it could be that that person was following most of the compliance and got it from the community or spread it. It is in the mainstream community. So we don't have to play the blaming game, but that person need then the most support. And I'm sure that the peer group support will be the most to have that person isolation, but at the same time being supportive for the physical things and for the mental things. So I'm very confident that you would have some counseling support, and students should not feel shy, because accept that this is the most stressful time. If I think when I was a year one student and sitting in the auditorium in my day one, I'm not finding it as energy and vibration and smiles on your face as I had. So I can already see that the stress is there, the anxiety is there, and that's normal that you have it. Now the question is how to come out of that stress and anxiety, that you have more laughter and more smile and more faces relaxed. And I'm sure my next colleague Sohail will come and there will be room full of laughter and smiles, right? And then, so among the peer group, you be supportive to each other, find mechanisms. So the third step of mental hygiene is your coping. So everybody individually identify that what is my coping? Is music, learning, talking to people, having a cup of tea. You can still have that. You can still do that as long as you are within the parameter of the safety. So find new ways of coping and support. And also very important thing, which we are trying to pass on, while the fear is contagious, we all were fearful as a community. It's time that we spread hope. Hope is also contagious. So consider hope that vaccines are going to come. That soon the time will be where we will again have all the sports, swimming pools ready, gymnasiums, and we'll have socialization with each other with no physical distances like we have created now among the chairs and cafeterias in every place. So I think keeping an eye on the hope and following some of the silver linings of COVID, and I consider blended learning as a silver lining of COVID. Also, it has taken the mindset of the time and space in a different frame. It used to be that faculty and students have to come to the campus 8 to 5, and they have to attend the classes in person, and the attendance was mandatory. The time and space notion has changed. Wherever you are, the focus is on learning much more. I want to say one more thing on the mask. The mask which we are wearing, most of us are wearing surgical masks. Surgical masks are very important when you are with the patient. But now, since many are asymptomatic, you don't know who is a patient and who is not. That's why most of us are wearing surgical masks. Oxygen intake is much at a different percentage going into our lungs. And therefore, it is important that we use individual spaces where we don't wear masks to have our oxygen saturation, our lung breathe. And therefore, exercise is important. You don't need to wear mask. You just physical distance and walk. But take fresh air. It is very important. More we are coming back to campus, we will be wearing masks for longer hours. Like I'm at work for many months now. And if I'm wearing 6 to 8 hours this mask, my oxygen saturation is very different. Cotton masks are also very good, and it has more breathable spaces. So if you are not among the patients, you can use the cotton mask as well. And use your exercise and individual spaces, take off mask and have breathing in the fresh air.
Thank you very much. Very insightful. And as you know that we have counselors on campus and you can meet with them, take appointment, and also you could access them online for counseling. Not only that, but we heard from the panelists that, socialize in different ways. And one way is the Office of Student Life. And one of the things that we have done after this COVID-19 situation is increased our activities. So in the month of September, you already have received our invites and posters. We have 40 activities, which is more than one each day. So lucky you, socialize, please. Meet with your friends and your faculty and your colleagues. But other than that, you heard about physical exercise, meeting with people, eat well, breathe well. And I wish you all the best. So thank you very much for your time. Before I finish, any questions? All right. Yeah. So there is one question which is, I believe, online.
Yeah, there's a
Please go
couple
ahead.
of questions by Mr. Sohail Awan online for Dr. Chris. He's asking, in a high flex model, will it not be disadvantageous for those attending classes online? And another question is that for out of Karachi students, when can we have a final word on when they'd be joining physically?
Very good. So the answer to the high flex question first is, and I'm not going to say today it's perfect, but it's getting better and better. So I taught a class this past week. I don't know if any students are here in my class. About a quarter of them were physically present in the room, and about 3/4 of them were not present in the room. From my perspective, now we had headsets on, and it was as if we were all online essentially. I think it was the same experience, whether you were in the room with me, or if you were at home, or if you were in Gilgit. I think if you were, our biggest challenge in a place like Gilgit, of course, is connectivity, right? So, like AKU, we've had to use devices like recording lectures on memory sticks and sending them up there so that people can get them later. It's not quite as immediate right now, and that's something that we're working towards. We have 3 classrooms. This is one of them, which is what's called high fidelity, high flex, which means that we can make it possible so that every person, whether they're in the room or around the world. I had a faculty meeting a week ago today. I had people on 4 continents and maybe 10 different time zones, and everybody was tuned in. Everybody heard everybody else, and it was seamless. That's what we're working towards, a situation where, regardless where you are, you feel as if you're, because you are experiencing exactly the same thing. So that's what our goal is. And we're about to invest in some more, they're called owl cameras and things like that will make the experience more and more immediate. And so it'll get better and better. and faculty will get more and more used to doing this. So I think that's what you should be looking forward to. So the high flex, I think, is the way of the future. That's what's going to look like going forward. The second part of your question is we're already a number of students from outside of Karachi are already making arrangements to come here. Some are living with family members or friends. Some of them are. We've identified some hostel opportunities for people. We had to close our hostel down because we couldn't get the level of assurance. I mean, basically, you know, I would urge people to look for living situations where you have your own room. Because that's the best way to really protect yourself. If you're in a hostile situation and you're living with 4 or 5 other people in the same room, I think that's very, very problematic. So, but if you're living either in what we call a bubble, which means you and your family and everybody's being careful, then it's much safer. Or if you can, and that's what we're working towards, a situation where people are in a hostel, but they're living in individual rooms, so that as Dr. Rosina just said, that AKU is at 30% or 40% hostel capacity, so that's really down significant. I would just say everybody here and online, don't lose hope. You know, this is going to pass. Pandemics are horrible. Ones like this, the last one was over 100 years ago. They don't come that often. You'll always remember this, probably not fondly, but you remember it. It will pass. It will go away. Either we'll conquer it with a vaccine, or it'll go away, because we've become so, careful that it literally is denied the opportunity to spread. Right? That's how viruses they can go. A predecessor of this was another SARS virus, which actually went extinct before they even got the vaccine. They had to actually develop the vaccine, but they didn't deploy it because the virus went extinct before they had to deploy it. This one is a much tougher one because it's not as deadly as the earlier SARS and MERS were, but it is, and it's because of this asymptomatic thing is really tricky, because you got 60% of the people who have it are walking around and they don't even know they have it. So they're not being caught thoughtless or careless. They just don't think they have it, which is why if everybody's wearing one of these masks, you can prevent it. So don't lose hope. I know it's really hard to start your college experience in this circumstance, but have faith. I mean, our main goal right now is to keep you on track, so you're not, waiting 2-3 years to start your life. You can, make friendships, make connections, getting you back as close to normal as we possibly can, while protecting your safety. That's what our goal is, and creating an environment so that you can, whether you feel that, because I think some people, and it's not just because they feel it, it's because they know it. They have elderly relatives at home. They have people with compromised immune systems they live with, so they just can't take a chance. But we want them to have the same, level of experience and education that those who feel more comfortable coming into class. So we believe that there's the answer is not one answer for everybody. For some people, coming and being in person is going to be better. And we can do that safely as long as we follow all these protocols, and as long as the community is disciplined, right? And everybody is participating in this. It's got to be a group effort, right? And if it is, then those people are going to have a great experience. And then the people who, either because they're fearful or because they have very real reasons, either they're immune compromised or they're living with people who are immune compromised, can still move forward with their education and not be delayed. That's what our goal is. And just don't lose hope. It's gonna, this is a moment, and this will test you, right? It's testing you right now, and you guys are rising to the challenge. You're meeting it, and if you've met this challenge, I can guarantee you this will not be the only challenge you face in your life. There will be other challenges you face, but as you face this challenge, you are learning skills and strategies for how to survive and how to thrive in it, right? And that's gonna shape who you are as a person. And it's a valuable lesson. It's not a lesson, I wish you were learning right now, but you are. And that's just the way it is. And you're responding beautifully to it. And so give yourselves credit. It is perfectly, there are moments where you're going to feel depressed and like, this is not the way that, it's supposed to be and so forth. And those moments will, as I said, this time will pass and you will grow stronger and more resilient and more agile. And that's what, that's what will last with you for a lifetime. The pandemic will not last for a lifetime, but the skills for how to survive in this moment are going to last with you for a lifetime. And so, keep hopeful, keep positive, and don't get depressed when you hear, oh, this thing's going to go on for 2 more years or 3 more years, whatever, because you're going to survive, and we're going to, get better and better at handling this situation so that no one gets sick. Yeah.
Thank you.
So just to add that the way we did the hostel entry, everyone coming back to the campus, mandatory testing. And those who cannot afford, we have a grant, not only for students, but for the community as well, for free testing right now. And also we are using a Sehat app. We've made an application named Sehat app with key signs. So we've created the academic bubbles. So green channel and red stops. So everyone who's passing and entering to the campus needs to show green light on Sehat app. And Sehat app is valid for 24 hours. So at night, it just takes 1 minute for you to work on your mobile. And in the morning, you show the green light, and then you can get entry. Once you come to the hostel first time, the testing, and then you go 72 hours in isolation. And if you are negative, then you are welcome to come back and start. And if you are not, then isolation is provided to you, food and everything, all the support. Once you are through, then you can come in. So these extra structure biologically for the support of the students have been created. So Habib could also think of some mobile application and creating a bubble for entry. And those who would be coming from outside, as the question was from outside people, then this could be used as a free testing facility, which currently AKU got a big grant, and that's why we are able to provide. Those who can't afford can use that.
Right. Thank you very much, Dr. Razina and Dr. Chris, for your time and insight on this subject. And I'm sure parents who are listening and students will appreciate it. Dr. Chris said that, you never know in the past, there's extinction of such viruses before even the vaccine was out. On a lighter note, there is a lot of money invested in research, but we don't care. Let the extinction take place. We don't care about the vaccine. And I hope that is the case. But thank you very, very much. We have a talk.
Thank you so much. So my take-home message is smile more than what you were, eat better, nutritious food than you were, sleep better, 6 to 8 hours than you were. So you should be okay. Don't fear so much. Relax and eat well, sleep well, exercise well, and smile much more. I like now many more smiles, what I'm seeing now when I started. Thank you.
Thank you very much. They had biryani. So if the eyes have gone like this in the beginning, that was because of the biryani. But if it's going now, then they are smiling. So there you go. Thank you very much. So Dr. Chris, as you know, is from here. And we have goodie bag for Dr. Razina. These are stuff from Habib University. Doesn't make sense to give Habib University gifts to Dr. Chris. So what we did, and you can see the
It's probably work.
packing
He's
is
probably
also
giving me a lot of
different.
work to do here. I'm just checking to see what it is.
If you can guess, oh, she likes the bag. So the bags can be exchanged, but but I'll tell you what's inside. Or do you want to take it out? But you can open it at home. All right. So, there you go. Now, we had live at student.live. How many of you watch these interview? Okay. Maybe not. You're new. I interview faculty members so that the freshmen and freshwomen batch know our faculty member better. So there was a quiz when I interviewed Dr. Chris, and we showed him mithai of Pakistan, and we asked him, name this mithai. So he got 50% correct, and the rest was incorrect. So we thought, let's give him mithai, and so that he gets to know what Pakistan delicious mithai looks like. All right, there you go. All right, thank you very much. Okay, maybe later, but enjoy this, okay. Dr. Chris. Please, you can join us because